So, good evening, everybody. My name is Adam. I am the marketing director here at AltaVita Memory Care Center. With us today, we have Lindsay Scott, who is our marketing director for our assisted living, and also Dr. Long, our medical director. So we all want to thank you very much for joining us today. I know it is definitely different times today with kind of how the world is working, and these educational events used to be in person and now they're all web-based. So we're more than happy to continue to do these educational events for you guys and provide this great information for you. Lindsay and I will be providing our contact information for you guys in the chat section. So if you guys have any questions, for AltaVita in general, assisted living in general, please feel free to go ahead and reach out to us at any point. During this webinar, Dr. Long will be able to answer questions. You can send those questions through the Q&A section, and Lindsay and I will get those questions to Dr. Long and get those answered for you guys. And then at the end, we'll definitely open it up for a question and answer session. So if you guys wouldn't mind, I'm going to turn everything over to Dr. Long unless Lindsay has anything to add.
I do not. Hello. I just say hello to everyone and thank you so much for joining. We are so fortunate to have Dr. Long as our medical director. She is a huge resource to us, to our residents, and so I hope that you enjoy this presentation. And if you need any further assistance or have questions related to assisted living, memory care, AltaVita, senior residences, please feel free to reach out to myself or Adam.
All right, Dr. Long, you want to go ahead and take it away?
Yes. Hi, everyone. So I am a geriatric psychiatrist and have been doing this for 24 years now. And the purpose of this talk is to kind of understand a little more about dementia and how to try to connect with them a little better. Some of this is, if you have attended some of my talks in the past, some of it is redundant because, it's basically the same information, but I have added some new slides to kind of have a better understanding of how to deal with people with dementia. And AltaVita, opened up in 2012, so we've been in business for 8 years. It's a family-owned place, and I'm biased, but I do believe that we have one of the best ones in the area because of the design, which I'll talk about at the end. But I always start with, sorry, it's not cooperating. There we go. I always try to start with meaning of dementia because, people have asked me all the time of, does my mom have dementia or does she have Alzheimer's? But usually the way I look at it is, that dementia is a series of symptoms. It will be like if you say, hey, I have cancer, and then they're like, oh, what type of cancer do you have? So it's kind of the same concept. So dementia is symptoms of short-term, long-term memory problems, impairment in abstract reasoning or thinking, impairment in judgment, personality changes, apraxia, which is like you forget how to do things even at the end. People may forget how to brush their teeth or brush their hair or put on their clothes. Aphasia is difficulty with speech, which I'll talk more about that because I think that's a very important one to understand. So if you have all of these or one of these, or it usually starts with short-term memory problems, and then it kind of, as you progress, it gets into abstract reasoning, thinking, impairment in judgments. People stop taking their medications or they drive carelessly. They have personality changes. You know, if they were really sweet in the past, they become agitated, or if they were agitated in the past, they may become more docile. So there are just series of changes. And then there are different types of dementia. And the reason we always think of Alzheimer's is because this is the #1 cause of dementia, is the Alzheimer's dementia, 55 to 65%. Vascular type dementia is when you've had a stroke or little mini strokes because you've had hypertension for years, and that's about 10 to 15%. And then Lewy body dementia, which is an interesting one. It looks like you have Parkinson's, but you really don't. It's a different illness than Parkinson's disease, but people look Parkinsonian. They have visual hallucinations. They have fluctuating level of confusion, which usually what that means is that they usually sundown really bad. So in the morning, they're more clear, but comes by evening, sundown, they get really confused. Parkinson's disease with dementia, about if you live 8 to 10 years living with Parkinson's, about 40% of people end up having dementia because of Parkinson's. So usually the difference between these two, Lewy body versus Parkinson's disease with dementia, is which one comes first, chicken or the egg. So if you've had Parkinson's since like your 50s or 60s, and you develop dementia by the end, it's Parkinson's disease with dementia. But if you start with memory problems and then become Parkinsonian, it's usually dementia with Lewy bodies. Frontotemporal lobe dementias, fortunately, this is kind of a smaller percentage of the types of dementias, but usually these start with personality changes, hypersexuality, aphasia. They have very difficult problems with speech. And usually the last thing that goes in this type of dementia is memory. But they're very difficult to deal with in general because of their behaviors. And right at this moment, we have about 5.8 million people with dementia in the US, and 17% of people with dementia fall between ages 65 to 74. 75 to 84, 47% of people between these ages have dementia. And after age 85, 36%. So as you can see, you know, we have one of the biggest part, this purple part, which is almost half of the population in the elderly, so that they would have dementia. And, you know, I've had people that tell me that, oh, we just don't see dementia in our clinic. And it can't be true, because if you're above age 75, there's 50% chance that you have a dementing illness. And the reason I like this visual too, because it shows you like when you get the plaques and the tangles in the brain. This is Alzheimer's patient's brain. And as you can see, as you get these plaques and tangles, brain is a protein, and it starts kind of shrinks. So that's what we call atrophy. And as this is the front of the brain, and this is the back of the brain. So as you can see, brain shrinks more in the front and some in the back and parietal lobes. And I compare it to an egg, because as the brain is a protein, and as if you cook an egg, it kind of gets smaller. It's the same concept, like this is a normal brain on the right. Hopefully we all have this one, plump and no holes, but with dementia it becomes with the holes. And this next one is really interesting because and I'll show you this again as we talk about the behaviors in dementia, is that, so this is a PET scan of the brain. This is a normal brain, and this is the early Alzheimer's brain, late Alzheimer's, and this is a child brain. And the top part is a frontal lobe, The back part is the back of the brain, parietal and temporal lobe. And as you can see, the more red you have, the healthier. You want more red. This is blood flow. And as the dementia progresses, as you can see, there's more purple and blue, which means there's not a lot of blood flow. But the brain starts looking like a toddler. So as they start having behavioral problems, it's not because they're trying to be difficult or they're becoming a child, but their brain starts to look like a child. So when they're having tantrum, they don't want to take a shower, or they don't want to eat, or they want desserts, it's because they don't have the frontal lobe and the parietal lobe to tell them that it's not appropriate. I usually show this to caregivers too, for them to kind of understand that your person is not doing this on purpose. It's their brain is just not functioning as well as it used to. And as you can see with this frontal lobe and the temporal lobe, so as the brain shrinks, what's going to happen is that there's going to be some changes in communication. They start having difficulty finding the right words. They use familiar words repeatedly. They describe objects rather than calling them by name. Like there's a memory testing that you show them different objects, and a lot of times a pen or a pencil is one of the objects that you show them. And I've had several patients that say, that's the thing that you write with. So they don't remember to say pen or pencil, but they know what it's for. So they describe it rather than calling it by its name. It's easy to lose the train of thought. So they start talking about something, but then they get distracted and they lose their train of thought. They have difficulty organizing words logically. So they may end up with verbs in the beginning or adjectives at the end. So they just can't organize their words completely in a complete sentence. And they revert to using their native language. So if whatever their first language, their mother language was, usually they lose their second language. My dad has dementia and he was perfectly fluent in English. However, now that he is almost 10 years into his dementia, he has totally forgotten any type of English, and he reverts back to his native language, which is Farsi. Even then, I kind of quite don't understand them because he's forgotten how to use the right words. And therefore, because they kind of know that they're not making sense, so a lot of them stop speaking. So they are speaking less often. They get more quiet. They're more isolative. And they can rely on gestures more than speaking. They start acting out what they want to say, or like somebody was asking for, they wanted ice cream the other day, but they couldn't say ice cream, so they were just showing me that they were licking a cone, like pretending that they were licking a cone. So they rely on gestures more than speaking. So these are some. Yes.
So there's a couple of questions that came in. One of them is, do communication changes cause stress?
Yes. We'll talk about it in just a second. Yeah, that's actually one of the first causes of agitation is aphasia.
And another question that kind of goes along with aphasia, does a historical searching for the right word much earlier in life indicate a precursor towards aphasia?
I don't know about that one. I guess it depends on why you're having difficulty with word finding. But sometimes it can be that people don't have enough attention span, or they suffer from ADD, or they may have other problems besides just dementia with word finding. But this is more along the line of the primary progressive aphasia, which can be progressive, so it gets worse with the illness. And then, as you mentioned, this can be a source of agitation for the patient. Since the patient feels misunderstood, it can also be a source of agitation for the caregiver, since the patient does not seem to understand directions. So that's exactly where you were coming from, which is the person gets agitated because they feel like you should know what they're talking about. I had a lady, she has frontal temporal lobe dementia. She's still alive. She has frontal temporal lobe dementia, and she would always say these words that made no sense. It was Gasher Gisher. She would always say that. And she would be so mad at you because you did not understand what she was trying to tell you. And she'll start cursing. She'll say, you know what I'm talking about, but nobody did. But that was sorts of agitation for her. And then with caregivers, when you are telling them, hey, let's go take a shower or let's go take a bath, and they don't understand what you're saying, it causes sorts of agitation for you because you sometimes you feel like they're doing it on purpose. So the semantic aphasia is when people, the person with dementia is speaking easily, but the words convey less and less meaning. So they tend to use broad general words. Like if they want to say cat, they just say like an animal. And the language comprehension also declines with the progression of the illness. So you can have difficulty speaking, but also you have difficulty processing the information or comprehending what's coming in. And then the non-fluent aphasia is when people lose their ability to generate words easily. So their speech becomes kind of tongue-tied and ungrammatical, and the ability to read and write is also impaired. So that's why there's a section in memory testing where you have them write something and then you also have them read something, because sometimes people are pretty smart and savvy about hiding their symptoms. So unless you actually have them read or write, they you won't know that they're having difficulty with that. Like for an example, there was a lady that kept coming into the ER, and they, what do? They send you home with these forms and things that says what was wrong with you, what to do, and then finally we figured it out after the third time that she came back, that even though she was college educated, but we figured it out that she couldn't read anymore, and she could not read the instructions, she could not read the recommendations, and that she should have not been living on her own any longer. So it can be a pretty devastating thing for them. But so the next, like I would say 10, 15 slides, I'm going to talk about feelings and actions of us and dementia patients. And I will repeat this at the end, because if you get anything out of this talk today, is that understanding that the feeling that your loved one have inside, it lasts longer than the memory of what caused it. So if you make him feel ashamed, or you're yelling at them because they don't want to take a shower, or they spilled something on themselves, and they may feel ashamed, they have that feeling, but they may not remember why do I feel that way, because they're not going to remember what caused it, but they will remember that feeling. And understanding that their world is guided by the gut instinct. So it's almost like, when you're a kid, or there's something wrong, but because your mom is angry, but you just don't understand what's happening, but you understand that you have that gut feeling. So be genuine in your interactions with them. and listen with your heart to understand the feelings, wishes, likes, dislikes, and needs of your loved one, because they're unable to express for you, but you know what they're like the best, and what their wishes are, and likes and dislikes. But I know it's very frustrating because sometimes you just can't handle it when it's constant. So the next few slides is going to be about always. So these are the things that you should always be aware of, which is be aware of your energy, because your mood, body language, and tone sets the mood for that moment. So they look to you for cues of how to behave and react. They might not understand the words, but they understand the tone. And this goes back to that slide I showed you about the PET scan of the brain changes, of how your brain starts looking more like a child. And it's, so if you've had a kid or a grandchild, you know that when you're angry, they're angry, or when you're happy, they're happy, and when you're fearful, they're fearful. They may not understand what's happening around them, but they're reading into your mood and to your energy and to your tone of voice. So I always say, you know, I say this for the caregivers at AltaVita, I always say, leave the negative energy in your car in the parking lot. But at your home, leave the negative energy in another room. So if you kind of feel frustrated and you can't just be around them, you need to walk away. And be aware that the energy in your house, like both frantic or calm, is contagious. So know when to be up and know when to be calm. So usually in the evenings, you know, when you're getting ready for bedtime, you know, playing some soft music rather than watching the news, having lower lighting, things like that would be more helpful than having the news on and be upset of what's going on, especially when you don't understand the context. And be aware of their energy too and mirror it. Like if they feel like they're sad, just hold their hand. You don't have to ask them questions. You can just hold their hand, give them a hug. If they're crying, just cry with them, or if they're laughing, laugh with them, because a lot of times they may not be able to express what's happening with them, but they feel that mode and energy at that moment. And respect them and their life accomplishment. You know, I showed you the brain that looks like a child, but it doesn't mean that this person is a child. It just means that their brain's starting to look like that, therefore they're going to act like that. And treat them with kindness. And I know it's really hard, especially when they're being annoying and they keep asking the same questions over and over. But try your best to treat them with kindness all the time, no matter what they say or what they do or how many times they say it or they do it. Like I've had family members that there was a daughter that just thought, you know, my mom just does this on purpose. She knows what time it is, or she knows when I'm coming home, but she's always asking me. And she kind of felt like she was taking it personal, basically. But understanding that they're not doing it on purpose and they're having difficulty understanding their own feelings may be helpful to stay kind to them. Again, I'm showing you this. I'm going to show you this one more time at the end because I think it's so important to realize what is happening in the brain is what's causing their problems. And then always allow them the freedom to be themselves and accept them as they are. So as a society and family and friends, we put a lot of pressure on them, and they know in their heart that they're not the same person, so they try to perform, which causes a lot of performance anxiety for them. So try not to ask them direct questions and don't expect too much. Set them up for success. Like, when you see them, don't keep asking, or when you're Zoom calling or you see them, don't keep asking them, remember, mom, you have a grandchild now, her name is Claire, remember? And they don't remember, so they get really anxious because they kind of feel like, oh my gosh, I should remember this. Why do I not remember this? So don't ask direct questions. You can just be kind of general, like, the weather is good. I had pie today, and, just kind of simple things rather than trying to pinpoint them, ask them specific questions. And then try to understand what they're going through, empathize, step in their shoes. This is a really, really great book if you want to understand what this person is going through. It's called The Best Friends Approach to Alzheimer's Care. And it is by Virginia Bell, who actually was a nurse that worked with dementia patients. And unfortunately, she started to develop some of her own symptoms. And at the beginning, she realized that, uh-oh, I know where I'm heading. So she started with actually one of helps of one of her friends, starting writing a book about her experience of what it was like to have dementia. And one of the parts that I always remember, and it kind of helps to understand, was she said every morning when she would wake up, she had to reorient herself and be like, okay, where am I? Who are these people? Because it was when she had moved to assisted living. Who are these people around me? What is going on? What day it is? So she said that was the scariest moment, was actually every morning when she would wake up and she had to orient herself. And then try to stop, like this is about the agitation that somebody had brought up. Try to stop an incident from escalating and getting out of control by stepping in and stopping it before it starts. So if you know that this person is going to get upset, like my dad, his issue is always food and wanting more food. He has diabetes, and my mom is always worried about that. But I mean, when I could see like, oh, this is where we're heading, I would just get up, get him a banana or half a banana and be like, oh, hey, do you want this? Is this what you were looking for? And, distracting him with food, music, or pictures of his grandkids or his travels of the past would always help. And nowadays, it's so easy to do like the Snapfish or online books, picture books that you can do to make what we call a memory book, which is, from their childhood to their children and then grandchildren, to kind of, or their favorite spot for a vacation or the type of work they did, to kind of come up with a book. And then staff can sit with them and go through the pictures when they're upset or when they're having a moment. And then try to have a list of things that calm them down, finding a quiet place in a different room, using headphones to listen to music, looking at pictures, offering food, drink, ice cream, chocolate. I know that I'm always happy with ice cream and chocolate. That's probably going to be me when I'm demented. But so trying to kind of have a little bit of a trick of what works for this person. And actually, like for my dad, he loves watching Jeopardy or America Got Talent. So on YouTube, as soon as you put in one of those shows, he's fine. Yeah.
Talk about when you're talking about food and drinks and ice cream. Talk about your dad and his sweet tooth. And
oh yeah, I have a slide in a minute. Yeah. Yes, we will, because he loves that stuff. I actually have a slide at the end about feeding. We'll talk about that at the end. And then try to look out for yourself too. Know when you need to step back and ask for help. Go for a walk, or just if you can't leave the person alone, go to the next room, close your eyes, do some deep breathing. Because like I said, it is hard to just be on your own and be by yourself with this person, especially during these times in COVID, when your world is so small, you're not able to take them to daycare, you're not able to go out for outings or gatherings. So try and see what works for you. If it's like meditation, or if it's music, deep breathing, anything. And then the next few slides are going to be nevers. So never scold them verbally or physically. And I know this can be hard, but try your best. Never argue with them or try to rationalize with them. The meaning of delusions, which is sometimes people with dementia have, is fixed false belief. So if this person has a fixed belief that they're still going to work, or that they're still taking care of animals outside, and if you're going to try to rationalize with them, you're not going to win the argument. And one example is, we had a gentleman at AltaVita that he, every night right around sundown, he would just say, I need to go bring all the cows in and make sure that the dogs are not out there. And the way we handled that was, oh gosh, okay, we'll go take care of it. Don't worry, it's all taken care of. We didn't say you don't have cows, you don't have animals here, because that would have not worked. And the interesting part was, when we talked to his wife, the wife actually said, oh my gosh, when he was on the ranch, he was 12 years old. He hasn't been on the ranch since age 12. So he had gone back and reverted to when he was a child at that age. But please don't argue with them. Don't disagree with them. Don't say, oh no, it's not, morning, it's nighttime, it's bedtime. You just say, oh, okay, well, let's go see what time it is and figure this out together. Don't lose your temper or shout at them, because remember when I said about the feelings? So they're going to feel bad about that, but they're not going to know why they feel bad about it. And I truly know from personal experience that it's much easier said than done. I've had to catch myself with my dad of, like, when he asks you 200 million times where my son is, while my son is sitting on the couch. So it's really hard to just say, oh my gosh, I already told you, he's right here, look at him. So it's much easier said than done, but I know that we just have to keep tab on ourselves. Never humiliate them or shame them, disrespect them, talk down to them, or treat them like a child. Never make them do something they don't want to do, which we'll talk about, because that's usually bathing and showering. They don't want to take showers, they don't want to bathe, but we'll talk about that in a minute. Never get into a power struggle with them, because you will not win and you will lose every time, and you will lose their trust. So this again goes back to the feelings of the delusional thoughts, and having delusions is fixed false belief. So if you're going to tell these people that, nobody's here, you're not going to work, you don't have to worry about the cows, you're just kind of get into a power struggle with them. They're going to be agitated, you're going to be agitated. And then the next few are how to help. So knowing how to talk to them, or what to tell them, what their triggers are. Do they need hugs? Do they have a good sense of humor? What is their dominant personality? Like, I've had people that, one of the best things for them is just having a good joke or laugh with them. One lady would have the same joke every time. she would ask you, you know, when she was upset, she was trying to be agitated, all you had to do was just tell her a funny joke, and she'll be she'll start telling you jokes. But and then some people, they just need a hug, but you know, you need to know the person, but know what to do and how to help them. And they're all different, right? Because we're all different people. Listen fully and with your whole heart. Use strong eye contact and comforting body language. So if you're tense and you got your arms crossed and you got the angry eyes, they're going to pick up on all of that, and they're going to give it right back to you. But making eye contact is huge, because they know that you're trying to get their attention, and they know that they have your attention. And when you're unsure of how to respond to their request or questions, repeat what they just said and agree with it. So just go with the flow. Be in the moment with them. Another example was, we had a resident who always in the evenings, she would say, "Oh my gosh, I gotta move my car. I gotta move my car." You couldn't tell her you can't move your car is not here. So we would just kind of say, "What? You need to move your car? Okay, well, let's see how we can come up with that. Oh, good Lord, I have your key. I'll go move your car." And that would be it. And she'll be like, "Oh, okay. Well, you don't have to bring back the key tonight because I'm going to be asleep. It's fine." So you just kind of repeat what they just told you and kind of agree with it. Even if it's ridiculous, just go with the flow. And again, a lot of people like the touch part, but you know, when appropriate. Obviously, if they're going to hit you, don't get too close to them to get hit. But if you feel like that they need a hug or arm around their shoulder, holding their hands. There was actually a study that showed the only time people in nursing homes or long-term care facilities were getting touched was when they were being changed or showered. So it wasn't really personal. It was actually kind of embarrassing for them. So one study showed that actually when if you put lotion on their hands and just kind of massage their hands in the evenings, especially right before bedtime, like with lavender oil, it can be very calming for them. Then never approach them from behind, because a lot of these people are already fearful and afraid, so you'll startle them. I have gotten hit before from, you know, when I approached somebody from the back when I had just started, and just kind of put my hand right on the man's shoulder, and he hit me pretty hard because, and it was my fault. I shouldn't have done that. He was just kind of reacting to what was happening. And usually announce yourself, or just say, hey Beth, or hey Judy, while you're approaching them. And then comfort and reminiscent, know their lives, you know, talk about their kids or whatever that they've done, like talk about the ranch or the cows, and allow emotion, go with it. Again, this is what I was talking about, like if they're crying, let them cry. There's nothing wrong with crying. And just say, "Oh, are you feeling sad, or are you feeling happy?" when they're laughing. So just allow the emotion, go with it. And redirecting, you also walk with them, change the subject, feed them, ask as few questions as possible. So when you start going, "What's wrong? What's your problem? What are you doing? Are you hungry? Are you sad? Are you fearful?" When you throw so many questions at them, you're just going to make it worse. So just calm down first, and then just kind of sit with them or walk with them or offer them food. Ask them for help. You can say, you know, "Hey, can you wash these veggies for me?" Or "Can you set up the table for me?" Because we're all human. We all want to be feeling needed is empowering. And work as a team. So like if, and again, I know right now it's really hard because of COVID, because our worlds are so small. That's why the webinars, but work as a team, you know, if you can get help, a new face sometimes can be amazingly helpful. And have somebody assigned, like a person to check in on them. If they're angry with you, sometimes a different person would work better. Like with my dad, he loved my daughter. So a lot of times we had her going to check up on him to see how he was doing, or do you want anything? Because he would never yell at her. And when in doubt, sing. You know, my favorite is Sunshine on My Shoulders Makes Me Happy by John Denver. Who doesn't like that song? So, and a lot of them, it's amazing because they know all the lyrics of songs, even though some of them may not be able to converse or have a conversation and have forgotten how to talk. But as soon as you put on music, if they were religious, they remember the hymns or gospel music. And of course, I can't tell you, everybody remembers Sunshine on My Shoulder. Okay, missed something? Yeah. Okay, this is, sorry. Okay, this is very important because I've been told by families over and over that I don't want to lie to mom, I don't want to lie to dad. And I get it, nobody wants to lie to anyone, but a lot of times I call this therapeutic lying. So it's for their peace of mind and for your peace of mind, so you're not making him agitated. And you don't need to explain every little detail because they cannot process the information, and it just makes them more anxious. I can't tell you how many times I had to go through this with my mom because she would try to explain to my dad every little detail of what they were going to do that day and who was coming over and what they were going to have for dinner. And he would just be more agitated and anxious because he didn't understand all the information. And truly, I mean, why did he need to know all that? But I think it was my mom just having a conversation with my dad because he wasn't talking as much. So it was more for her, but then it was agitating him. But what I'm saying is not to lie about day-to-day stuff, you know, like that lady's car or the gentleman's cattle. And so it was just like things that are day-to-day, not about like history or family. Sometimes you have to lie about, and this is very individualized, but I have suggested for families to lie about the spouse death because they live that moment of, remember, Joe is not alive anymore, and it will be a whole grief and crying and when did he die and how did he die, and very stressful situation, everyday trauma. So when we started telling this woman that Joe is on a research travel, things got a lot better because she was familiar with the fact that when they were younger, he always traveled for work. He did research, so he always traveled for work. So it was a lot easier to tell her that Joe is traveling for his research work rather than Joe died 2 months ago. So again, this is very personalized information, but I always say, imagine it as a therapeutic lying because you're not lying just to lie, you're lying to make their lives a little better and your lives a little better. So again, that slide I showed you earlier, this one, look at this, they don't have their frontal lobes. They lost their frontal lobes. So you and I have our frontal lobes. Well, hopefully we all have our frontal lobes. So we need to be their frontal lobes to keep them safe, happy, and content. Some days there's no winning, so I know it's not easy, but we need to keep in mind that we still have our frontal lobes and able to set limits and keep our emotions under control while they're unable to do that for themselves. Okay, so now the next few slides, I know we're getting to the end of time, but next few slides, I'm going to talk about some simple things which can be very hard. Bathing is often the most difficult personal care. And why is that? Because look at this, they're like a child brain. And what does your child say when you say it's time to take a bath? No, I don't want to take a bath, no. And sometimes you have to trick them. You say, you know, get in the bath and then you can have a treat, or I'll read you a book after bath time. And you set up a routine. So you can say like every Wednesday evening or every Wednesday morning, depending on what time of the day they liked their baths in the past, you set up a routine. And you give them choices. You know, you say, do you want a bath or versus shower, or now and or in 15 minutes? And gather the supply, have a big towel. Don't, you know, fumble around when they're in the bathtub or in the shower and try to get the supply, because you only have a finite amount of time to get them cleaned up and get them out really quickly. Make the room warm and comfortable, water running. Coach them through the steps. You know, you give them a soap. Hey, wash your body, wash your underarm, shampoo your hair. Give them something to hold because you want them to be busy, kind of like a child, you know, when you're giving a child a bath. So give them a washcloth or shampoo bottle to hold. And if you can have a familiar same-sex help with the bathing, like when we were doing it with my dad at home, we had my brother who would come on Saturdays to help with the showering, and it was a lot of work because, you know, I had to go in there, I had to get her in there, get all the stuff, and then my brother would step in. But try to protect their privacy and dignity with the towel, especially if they're not familiar with this person, or if it's a PRN caregiver. But it is one of the most challenging cares for somebody with dementia. And the reason is a lot of times they think they just had a bath or they don't need a bath. And of course, and I get it, I mean, they're not doing a lot of stuff, so they're not sweaty. But one of the main things that you need to take a bath for is because you are very susceptible to urinary tract infections. And if you're not bathing enough and you're not washing your private parts, it's a pretty good harbor for urine infection. Dressing is another important subject, that simplifying the choices, like keeping the closets free of excess clothes. So don't have like hundreds of shirts and pants. So usually the best thing is to put up actually on the same hanger a set of clothes that you're going to wear, like you have shirt, pant, socks, underwear on the same hanger, and just have like 5 sets in the closet rather than multiple shirts, multiple pants. So simplifies the choices, organize the process, and that's what I was talking about, laying out the clothes for them. And then giving simple, direct instructions. Put your arm in the sleeve, put your leg in the pant leg. And then you may have to start using zippers because they don't, their hands doesn't have enough dexterity to button. And then picking simple and comfortable clothing is very helpful. We had a gentleman who would hit and scream during changes, but then coming to find out that poor guy has had a problem with his shoulder most of his life. And then of course, as he got older and demented, his wife died. Nobody like remembered to say, hey, this guy's right shoulder is very painful when it's elevated. So after we started using front zipper shirts, like then we didn't have to pull the shirts over his head and over his shoulder. Guess what? He wasn't hitting people during changes. So choosing comfortable shoes, so not having lace, having Velcro would be helpful. And then be flexible. If they want to wear the same clothes, then just buy the same outfits. Don't be so upset and obsessed over what they wear. And if it's mismatched, focused on positive stuff, that at least they're getting dressed. Because my mom used to get mad because she'd be like, well, that doesn't match with the pants. And I'm like, Mom, at least he's wearing clothes. He's not naked. Mealtime. Mealtime is a big event of the day. And the reason being, I always say, is like, this is the only control that they have over their lives. Because at this point in their lives, we're telling them where to go, where to sit, here, take your medication. But at least with the food, they should have some say in food. And what Adam was talking about was, my dad has diabetes, and my mom's always worried that, oh my gosh, he shouldn't have 2 pieces of chocolate cake. And guess what? As you get older, and especially with dementia, your taste buds are diminished. And the worse the dementia progresses, the only part of the taste buds that's left is the sweet part of your tongue. So usually they like heavy and sweet food. So ice cream, chocolate cake, frosting, they love dessert. And for my own dad, I have come to tell them that give him whatever dessert he wants. I don't care. You can give him more insulin if you need to. But at this point, if that's what he wants, that's what he gets. And then, like I said, it's a big event of the day. So try to make the mealtime as peaceful as possible. So don't have distractions of, don't have the TV on, have the music on. Simple foods, don't have like a whole bunch of stuff on their plate, only 2-3 options. And then sometimes as their dementia progresses, they're not able to handle utensils. So having finger food works for them. Adam, is that what you were talking about?
Yeah, with your dad. Yeah, because I know how your mom was always like very concerned about the his blood sugars and his diabetes with the ice cream, but he loved ice cream, and we loved giving him ice cream because it just made him so happy.
Right. Yeah, I know. And he's pretty clever actually, because when you give him sorbet, the sugar-free sorbet, it's in the cup, and he's like, oh no, I want that ice cream on the cone. I don't want a sorbet in a cup. And another funny thing about my dad is, so he was always no alcohol, and he would get mad at us if we drank. And nowadays he always wants beer, and which I don't understand, but he's always asking for beer, wanting beer. And in the past, when we would go out, and I would get him some non-alcoholic beer, but for whatever reason he knew, and he always wanted my husband's beer. I was like, no, I don't want this one. I want the other one. So who knows? But so this is the next few slides. I know we're not doing any gatherings right now, but hopefully after we get vaccinated and get back to normal in 4 to 6 months, I like putting this in here because it's really important to prepare the family ahead of time. Even if you have to video chat, call, or write a note to the family that, this person is now very demented, and, they may be chewing loudly with their mouth open, pass gas, talking loudly, interrupting others, walk away in the middle of conversation. And just kind of try to tell them that this is the new normal. So they're not so shocked, and they don't take it personal if the person walks away. And then pick a time for the gathering that fits the person's schedule. Like some people are, like for example, my dad, the best time he's on is like around 2-3 p.m. So earlier he's sleepy, later he's kind of wild and more confused. So if you're gonna get a gathering together, it would be 2-3 p.m. And then give yourself permission to leave early if that person is not doing well. And then also, we used to ask my kids to stay with my dad so my mom could go to parties because, you know, she wouldn't enjoy it. He didn't really get why we're going, and he didn't really understand or enjoy it either. And then keeping things simple, but including them in activities. Again, it could be something like rolling out cookies or washing veggies or setting up the table. And this is also important too. Like I said, my dad never used to drink alcohol, but now he wants to. But he already is disinhibited and does not have his frontal lobe. So giving him alcohol, it just takes away any social inhibition that he has. And of course, can make him unsteady too. So minimizing the alcohol as much as possible. And if it is a holiday ritual, either watering it down or using non-alcoholic beer or wine. And then there's so many good mocktails these days, recipes online that you can pretty much trick them into like drinking gin, but a gin tonic without the gin, just the tonic part, or margarita, because the alcohol can interact with their medication and also can cause falls. It can increase the confusion. It can increase disinhibition. It can make them more agitated. So just not a good thing for them. And then knowing in your heart that if you allow them to be in the moment and make that moment joyful and safe, then life is good. Then emotional response lasts far longer than any memory or of eliciting that emotion. And they will be happy for 24 to 48 hours after your visit, like the Zoom visit or physical visit, even if they don't remember your visit. They remember that feeling. And this is, again, that slide that I showed you at the beginning. So the feeling lasts longer, even if they don't remember what caused it. So this can be a good feeling or a bad feeling or a shameful feeling. So it will last longer. And understanding that they are guided by the gut instinct and listening to your heart, listening with your heart to understand their feelings. And these are few of my favorite pictures of my favorite people at AltaVita. Because, you know, we always talk about dementia being a sad illness, but it doesn't have to be. Again, these are some of my favorite people I've had along the ways. And AltaVita is a state-of-the-art secured community in Boulder County. It's locally owned, locally family owned. And we have what we call neighborhood concept. I know it's hard to do any visitors now, but I think Adam and Lindsay have some virtual tours set up. But it's a neighborhood neighborhood concept. So there are 4 different sections of the building, and they're color coded and they're named differently so they remember. And then individuals care planned with stimulating activities. Oh, this is the inside if you've never been in there. But this is one of the communities that I'm talking about, which is a neighborhood concept. And with that, oh, I always leave with this. The Alzheimer's Association is a terrific program. Any money donated to them, 85 cents per dollar goes to their programs. They're usually run by volunteers and they're always there. So they have 24/7 support center. And there's an 800 number, and also they have lots of information online. And they do have a program, it's called Safe Return. So if you still have your loved ones at home, I would suggest you do the Safe Return bracelet, which is you sign up through the Alzheimer's Association, and they give a bracelet. It has an 800 number and an ID number. So if the person is ever lost and found by someone, they're able to call the 800 number and to be found, to be back with their family members. So that is my last slide.
All right. Well, so we got quite a few questions, Dr. Long, and I think some of them are really good questions, and other ones are really, really easy. So I think one of the more easier ones, how likely is a child of a parent with dementia to develop dementia too?
Say what?
So if my mom has dementia, how likely is it that I'm going to get dementia?
Oh, so you're definitely at higher risk, but just because your mother had dementia doesn't mean you will develop it. But usually they say if it's one parent, it's 4 times likely that you're at risk of developing dementia. But of course, your risk doubles if it's both parents. But some of the things that you would do to help, it would be like if you had, your parent had a history of heart attack, it puts you at higher risk of having a heart attack, but doesn't mean you're going to have a heart attack. But some of the things you can do to slow down or decrease the risk of developing dementia would be, the best thing you can do is exercise, like aerobic exercise, 20 minutes, 3 to 4 times a week. And whatever is good for your heart is good for your brain, basically. So Mediterranean diet and exercise are the best ones that are out there. But just because one parent has it doesn't mean you're going to develop it. And age is number one risk. So if you live long enough, like that, I showed you that slide, that after age 85, 50% of people have. So as we live longer and longer, and that's why we're seeing more and more dementia, is because as we're keeping people alive longer and we're increasing our lifespan, we're going to see more dementia.
So that kind of leads into 2 other questions that we've gotten. And you answered part of one of them. So what are your thoughts on the current literature claims by neurologists that diet and exercise can be used to prevent, which you already answered, but even reverse dementia?
Yes. So, I mean, those are all new information, but I can see why. I mean, that because what happens with exercise is that you're increasing endorphins and increases that, let me show you that slide, because you're increasing blood flow to the brain, which helps, sorry, oh, that was it. So blood flow to the brain with the exercise, and eating better, again, increases blood flow to the brain by decreasing plaques. So yes, exercise and diet, keeping your sugar under control, keeping your blood pressure under control, anything that can cause brain damage, there's increased risk of dementia with people with head injury. So making sure your brain is protected. So all those things, whatever good is for your heart is good for your brain. But yes.
But once the damage has been done, it's irreversible, right?
Well, so as we saw that first picture, if it's true Alzheimer's, yes, because you get those plaques and tangles. But if it's vascular type dementia, which is usually like a stroke, we're finding out that our brain is pretty it's able to rally up the neurons next to the damage and be able to get some abilities back with PT, OT, cognitive therapy. So it depends on what kind of dementia you have.
Okay. And it seems so somebody said my dad's dementia seems to be worse since COVID due to the isolation. And we know that isolation can cause a decline in somebody's cognitive abilities when we're talking about a diagnosis of dementia.
Right. But also it can be, if you're depressed and anxious too, it can make your dementia seem worse. So with COVID, what I've seen is that, there's a lot of huge increase in anxiety and depression. Therefore, they're having, it seems like they're having more cognitive problems. And if they're not talking to people, obviously the less practice you have with speech, the more problems you're going to have with increased confusion. And then we've also seen increased rate of suicide in geriatric population with COVID because their world has become so small. And there is a term, it's called pseudo dementia, which is like if you've never had depression before and you turn like into your 60s or 70s and you have severe depression, it almost looks like you have dementia at the beginning of severe depression. And as your depression gets treated and your depression improves, your cognition improves too. That's why the term pseudo dementia, because it looks like you have dementia, but if you treat the depression, a lot of times the cognition improves.
And so somebody with dementia right now with the pandemic, it's kind of better if they don't talk about it and we're not bringing it up because they're not going to necessarily understand what's going on, and they're in this kind of blissfully unaware state where, if we don't talk about it, it doesn't really exist for them.
Yes, it's kind of like living. Yeah, it's kind of like living in your own bubble, like especially like at AltaVita. Of course, I'm biased, but when you walk to AltaVita, it's such a happy place because they don't know what's going on outside of that place. But yeah, it's better. I mean, what are they gonna do? Like, I always question this with my mom, like, because she wants to give details to my dad, and first of all, he doesn't understand what she's talking about. But then I'm like, what is he gonna do with this information now? You just made him anxious and nervous. And he's going to remember that, why am I nervous? But he won't remember why he's nervous, but he just knows that he's nervous now.
Right. So do high sugar levels add to dementia?
Well, if it's at early stages, yes. But at later stages, like with my dad right now, he's so severely demented that I just feel like it's better for him not to be agitated because he wants to have that extra piece of chocolate cake rather than keeping his sugar under control, because I know that his dementia is irreversible at this time. But when you're in your 40s, 50s, and you have diabetes, you really need to make sure that your blood sugar is under control, because as you can see here, the glucose metabolism in the brain, and it can damage your kidneys, it can damage your heart, it can also damage your brain.
So, question, I think we've kind of answered this a little bit. The number of dementia cases are on the rise, or is it just that we're diagnosing it better? And kind of from what I heard from you earlier was that it's more so people are living longer, so we're seeing more cases.
Yes, age is number one risk, especially for Alzheimer's. And we're keeping people alive longer. Like another example would be Parkinson's. People didn't used to live with Parkinson's past 4 or 5 years, but now we're keeping them alive like 10, 15, 20 years. After 8 to 10 years of being living with Parkinson's, your risk of dementia is at 40%. So as we keep people alive longer because of better medications, but unfortunately we still don't know how to slow down the dementia. So that's why we're seeing more. And yes, of course, we're diagnosing it more too, because it used to be when my grandpa was alive, we would just say, oh, he's just old, you know, even though he had dementia. Well, we just called it old because he didn't remember stuff. We didn't give it a name.
So I think this question is more so geared towards the, like, how do we interact with somebody with dementia? But it says, I'm hearing, don't argue, don't force, no rules, anything goes. And I think it's more so anything does go, just as long as we're staying within that safety kind of realm. We're not putting that individual or ourselves at risk.
Oh, well, yeah, definitely. It'll be like if you have a toddler and the toddler wants to run in the middle of the road because they're going after the ball, you just don't say, oh, okay, go. You try to keep them safe, even though if it makes them angry and they're going to cry. So yes,
Right.
safety's number one. So anything goes as far as like they're safe. So don't argue with the fact that, you know, you don't have any cows out there, but you're not going to let them go out there looking for cows in the middle of the night because that's what they want to do. So it has to be safety first, but arguing with them is not going to help anyone.
Right. And I know there's a couple of other more lengthy questions. And I know one of them's from one of our family members here at AltaVita. You can definitely shoot that question over to me and Lindsay in email, and we'll definitely reach out to you with answering that question specifically. But there was a question on here about drinking. And how does drinking alcohol during a lifetime increase dementia? And while there is a dementia that is specifically caused from alcoholism, correct?
Yes, that's a real thing. And basically what alcohol does, it kills your frontal lobe cells. And so when you are intoxicated, your frontal lobes aren't working. Therefore, you're disinhibited, right? So some people that are intoxicated, they're really loud, they're get into fights, they, you know, promiscuous or whatever, like it can be different things to different people. And it is because your frontal lobes are affected. And as you drink more and more and you drink for years, you do kill frontal lobe cells. And they have done MRIs or PET scans of people with severe alcoholism for many years. And even if they quit 20 years ago, now at age 70, whatever, if you do a brain scan, they have smaller frontal lobes. And usually with alcoholic dementia, a couple of differences is that they confabulate. So, and what that means is that they make up stories that they all sound pretty reasonable, but when you talk to the family, they're like, oh no, my mom never was on a cruise for 3 years or whatever. You know, they confabulate, and some of the stories are just seem like they could be real, but they're not. But basically, yes, you do kill your frontal lobes. And the way it's different is usually they're more agitated, they can be more disinhibited, so they can be more hypersexual, more difficult to redirect. And unfortunately, even if you did quit, you know, 20 years ago, the effects can still come out after age 70. So the moral of the story is, if you're younger, don't drink too much. And, you know, the CDC now says, you know, you can have one glass of red wine is actually a good thing for dementia, but more than that is not, and more often is not.
And our last question is, how many of the symptoms you showed in the first few slides are necessary to have dementia?
Well, it's not how many. So like I said, it's a cumulative effect, and also oh, there you go. So it can be at stages. So sometimes the first thing that can change is a personality change. And sometimes it can be a judgment change. And as they live longer with it, then you see more and more. Like I had one lady who came to me, and I knew her for 12 years before she got really severe and actually died. But her only symptom when she came to me was that she was a cashier at Macy's for 27 years, and she could not figure out how much to give back when somebody paid cash. And she said, I have been a cashier for 27 years. This is not normal. And I believed her. And another reason that she knew she was going that way was because her mother and her maternal aunt both had dementia, and she took care of them. So that was like her first sign, was that she could not, she was not able to calculate money like she used to. And then her next thing was she started to have short-term memory. And the next thing was that she started to have impairment in judgment. Like she knew that she should not drive, but she still wanted to drive. And then the last thing was, she started having difficulty with her speech. So this can be, you can have one or all of them. It can be just from what your changes from your baseline. And at the early stages, what we call mild cognitive impairment, sometimes it's hard to determine if that's where you're heading or not. And the best test at that point is called neuropsychiatric testing. And it's about a 3 to 4 hour memory testing, and it is done by a neuropsychologist. Medicare pays for it. So if you have like questions of, where am I heading, or is that my problem, or you're worried about it, you can always get neuropsychiatric testing to determine the baseline.
Well, Dr. Long, that was all of the questions. Thank you so much for this. Was probably by far the best webinar that I think we've done. A lot of great information, and I know we went over our time, but it's okay. And to all of those who are still with us, thank you so much for joining us this evening. We really appreciate it. We love giving these educational talks for you guys, and we'll continue to do those. This webinar will be, it is being recorded, and it will be posted on our website as well as our YouTube page. And in both of those areas, you can find different webinars that Dr. Long has done with great educational things. Most recent one, Dementia and Holidays, give you guys some information about how to handle the holidays with your loved ones. So thank you all for joining us. Dr. Long, Lindsay, thank you. And if there's any other questions that you guys have, please feel free to email me or Lindsay. We'd be happy to answer your questions, whether it be about the different types of care here at AltaVita, dementia, or just different resources that you may need. We're more than happy to answer those.
Yes, and I'm always available too if you want to email me the questions.
Yes, I'll definitely send them to you if I don't know the answer.
Okay. All right. Thank you, guys.
Thank you.
Thank you, Adam. Thank you, Dr. Long.
Yeah, thanks for attending. All right, bye.
All right, good night, guys.
Have a happy holiday season.
Same to you. Bye.
Bye-bye.